I don't know what you guys are talking about. So there you go. Anyways, it's all good. And I told him he could come. So it's okay. We still have a full 40 minutes before Jose comes in and speaks. So it's just the three of us. Julia can't join us. Unfortunately, she is getting a root canal. Oh my God. At the dentist, and it was a bit of an emergency last minute thing. So yeah. And Linda's working, and who else is going to be here? Patrick was supposed to be here. He was going to talk about, but I see he's not responding to my text. So it's the three of us.
Yay!
So Nikki, you heard this morning if you were with us, and Amanda, you know from all the other ones. But I'm gonna let them introduce themselves again. Y'all know me. I do APL Go, which is the supplements that we're going to be talking about a wee bit. I wanted to actually, you know what? I have the metabolic reset, which I can talk about later. But I just wanted to show this one. Do we still have the special one? Can someone look and see? I forget what the dates are, but these two products, I just want to say this. These two products in the last maybe 6 months have been probably my number one sellers amongst all of my clients. This will help you sleep and calm down. This will help, literally, the word is happy. It will literally help you to be happy. It will help with anxiety a lot. Like, it actually works. I don't really suffer a whole bunch from anxiety, but I have taken these sometimes, like when sometimes when I have to travel a long way and stuff, it just kind of keeps me alert and whatnot. This one helps me sleep. I usually don't have trouble sleeping, but I will take this one with me on a trip because sometimes when I change environments like that, I get a little weird. And then I just need help to make sure that I'm sleeping because I'm doing so many other things. But I did want to talk about these two products and how incredibly helpful they are. I will name off some ingredients later on. But these two, if you are suffering from anxiety, depression, can't sleep, help me out. Anybody else have anything else?
Stress, general stress.
General stress. Perfect. There you go. That one, I do want to bring this one up because there has been, so along with this, it causes us to not have so much energy. So this one here for the energy and boosting your energy, this one is a perfect complement. And just because there's been a lot of colds, but it seems to be a real big respiratory issue. And I don't know if it's just, it's been a very hot year and a very wet year here where we are in Canada. So this has been my savior for lungs. I can't even tell you. I was at a party and I gave some to a girl. She was having a really tough time breathing and she was using an oxygen tank and she didn't have to use it after these. Like, it's really good. I don't want to talk too much about that, but I do want the girls to actually introduce themselves once I actually stop talking, which will be soon, I promise. So not only do I do the APL Go, I also have a publishing company and Empowered Talks, this platform. I'm also a real estate agent. I do some international investing and I work with a lot of other agents. I love the investment field. It's my favorite. I really get into that whole side of business, and the more international, the more spectacular. That's why when Patrick was on earlier and he was telling me that he was working internationally as an accountant, I was like, wow, I didn't even think that was possible. Like, how cool is that? So I love that the internet has connected all of us together. I also have a podcast called Meditation Millionaire, and I'm going to be coming out with a real estate one called Real Estate Ins and Outs. I've also joined a bank, which is a spectacular bank code. So not a bank, although I did used to work at a bank. The bank I'm talking about is Code Breaker Bank Code. So these will help anyone who, which is pretty much all of us, anyone who does sales. This will actually help you uncover the different personalities, understand them better, which will allow you to communicate better with them in their code. So if you're a hyperactive, crazy person like me, and you can communicate with me, that's going to be easy for you. But if you're going to communicate with someone who's an introvert and who needs more information, I don't really require, in fact, I don't want extra information. I don't want too many details. If you give me too many details, I'm going to tune out and I'm going to start looking at my phone and not pay attention. But for someone who does, I recently had a conversation with a client, and I did get the listing, and not just the listing, he has 9 other properties. So I'm going to be doing quite a bit of business with him, but an hour and a half conversation that I don't think I would have been able to hold before I learned about these. It just gives you that understanding. And while I love people, I just sometimes I'd be like, I don't understand why you asking so many questions. Like, what part of this didn't I explain? And now it's like, no, this is what they do. Even after I've answered 50 questions, they'll still walk away going, okay, I'm going to go do some research. And I used to get offended by that. Like, what part did I explain? But that's what they do. And I have a really close friend that does that. She's actually that code, like that's her main code, and nurturing, of course. And I just was like, what? Why do you have to research everything? But that she still does it. And it was so funny because this helped me understand her and allowed me to love her more, because I'd be like, oh, okay, that's just what she does. And she was giving me instructions the other day to get to her cottage, and I followed them. And she goes, yep, I made them short, like you like it, to the point. So she sent them to me. And then when she sent it to me, I actually took like a smaller paper thing, so I would have the instructions, because the GPS wasn't going to go there. So I had them just so I could quickly look at them while I was driving. I shortened that even more, but I don't want to tell her that. So I had to shorten it more, because you can't, like when you're looking, you just need to go left is in big letters, right? Or right is in, so you know where you're going. Never mind the little explanations, right? But it was so beautiful the way we were respecting each other. So this comes with a whole program. There's an affiliate program. You want to make money. You're going to make money with this program, is the bottom line. You're going to make money because you're going to learn how to speak to people better, and you're going to make money. We're going to talk more about that later. So I don't want to take up this section, although it does help you when you're speaking with people to understand where they're coming from and their health issues. And now I am going to be their health issues. And now I am going to be quiet, and I'm going to let Nikki introduce herself, and then Amanda. Okay, go ahead, Nikki. Thank you.
Thank you very much, Marianne. And everything you said is so true. But you know what? I learned that we have to know who we are first, and we have to know what our issues are first. My name is Nikki Cruz. I'm commonly known as the Joy Junkie, and not my claim to fame, but I spent 11 years in a wheelchair and told I would never walk again. And I was miraculously healed out of that wheelchair, didn't realize I'd walked, and I've been walking ever since. And as a result, I have learned that we get to see beyond our circumstances, and we get to change our mindset about things. And recently, I discovered that some of those things that hinder us are not just mindset. They're the physical things that affect our body. And I know a lot of people think, oh, wow, you got out of your wheelchair. You started walking. That was 3 years ago, by the way. So everything was hunky-dory. No, it wasn't. I did have some health issues that remained. I had some joint pain. Obviously, my body had to recur. And I recently got to know Marianne a lot better when I started using candies. So we'll talk more about that in a moment. But, it affects your mind. It affects your mindset when you are not at your peak health. Am I at my peak health? No, not yet. I'm working on it, and I think it will be a lifelong journey. But candies certainly have helped me get there. So over to you, Amanda.
Hello, I'm Amanda, and I joined APL Go with Marianne a few months ago. I also had I had a serious car accident, so with that came some health stuff, and as I was getting to know Marianne a little more, I started talking to her about it, and she kind of showed me the products, and I've had really good results with them. So we'll probably talk about the products a little bit more in depth, but yeah, so I'm happy to be here.
I'm going to just jump on before you come back, Marianne, and just say, when you've had health issues all your life, you get so tired of everybody bringing you the next best solution. And I've had that all my life, but then especially being in a wheelchair and everybody suggesting everything, you get so tired of hearing it and people not actually listening to what your concerns are. And somebody recommended the APL Go to me, and I thought, oh, all right. And I bought a box, and all right, yes, it's not going to work. And I'm diabetic. And the one day my sugar was running really high. And I just sat there and I thought, oh, well, what am I going to do? I may as well try it. And it worked. You get yourself into such a mindset that everything's not going to work because you've had so many things that didn't work. And I know Marianne's going to talk more about what makes this so special and so different. But if you're switching off because you don't want to hear, please stick around and listen, because this really made a difference to my life. And for the first time ever, I believe that there is going to be some correction of situations I have that I never thought, and the doctors have always said will never be corrected, that have been the result of prolonged and excessive use of necessary medication at the time. Had I had these at the time, I probably wouldn't be in that state in the first place. So don't switch off, stay tuned and hear all about it. You're on mute, Marianne.
Everybody hold up an HPR. If you love your liver, hold up an HPR. No, I love that. That's my new thing now. So HPR, I just want to say a little bit about this is for everyone. I don't know one single soul over, let's say roughly over 20, or if you've had an exciting teenage year, and if you were born in the 60s like we were and you partied your whole 70s away. These are excellent liver support supplements. They will do a very mild cleanse. You won't even really feel it, but it's more of a support to help your liver be healthier. And let's face it, all our toxins go through the liver. And if they don't get dealt with properly, they end up on our skin. So as we age, this becomes more and more important, because us women, we have menopause, and I know that men have, they should call it womenopause for them. They have it too, they just get it different. And we have stuff for that as well. I don't have, does anyone have an PWR close by to show me the box? You got to show it lower.
Right.
Yeah, there you go. These two, I can't tell you enough about these. So the one that Amanda's holding up is the testosterone. This is the estrogen. The estrogen has, yeah, thank you. And Nikki has both. So estrogen, this one will have also calcium and iron. And let me tell you what the testosterone did for me. So I would get up roughly anywhere from 5 to 6 times a night to go to the bathroom, to urinate. I go once, depending on how much I sleep. I can go 6 hours of sleeping without getting up once. Do you know what a huge, if you don't know, if you've never had to get up 5, 6 times, you don't understand how good and how important that is. To be able to go once, or sometimes not even once. Sometimes not even that. Now, I'm not saying I'm going to chug a lug 2 liters of water before I go to sleep and I'm only going to get up once. No, that's a different story. But if you're having a normal day, I didn't chug a lug 2 liters of water then either. And so that is like a huge thing. And it strengthened my bladder. And I believe firmly that it actually helps with the kidneys. It helps to strengthen them. I don't think it heals them completely if there's, hardcore issues, but I have seen some serious improvement in the kidneys. So, and I cannot not say anything about this product. This is a lifeline for most people. This is a microbiome balancer. I can't say enough about this. For a person who has suffered now, I'm 62 years old and I'm super proud to say that I am on zero medication, zero. I am not a medication lover. I will try different things. I will only take meds when I absolutely have to. I have had to take antibiotics for far too much of my lifetime. Bronchitis and sinusitis were my two culprits. I was on all kinds of antibiotics unless I had some sort of dental surgery. That's it. So this one is super great because this will eat away at parasites, and candida's a parasite. And when you take that many antibiotics, you have candida. I don't care who you are. I don't care what you think you're going to tell me. You have candida. So this will help with candida, and your belly will go down. This will help bring your belly down. Not this by itself, although this by itself will probably do a little bit too. But if you really want to bring your belly down, we're going to talk about something called the 30-day metabolic reset. I have them here. I can tell you the products, but before I go do that, we'll see how much time we have left. I can do it fast and I can do it slow. Would like Amanda to share with us what she thinks of energy drinks.
So, a lot of people know that I was really like hooked on energy drinks. I was drinking probably 2 a day, and I had an issue with my weight going in just to my belly, because I was consuming an exuberant amount of sugar and caffeine, because those drinks are just loaded with that and everything else. And so when I first started with the APL Go, Marianne suggested for me to start the STP and the GTS. And so the STP helped me actually cut back on the caffeine and kind of deal with the withdrawal from the caffeine, because when you drink that much caffeine a day, you kind of get the jitters and the shakes and stuff like that. So I was taking the STP a couple times a day with the GTS, because the GTS was for the energy and the stamina and just mood and overall feeling healthier and having that strength, right? That energy. And I would get that kind of low down at 2-3 o'clock in the afternoon. Sometimes that's when people go for their second coffee or their tea or whatever they drink in the afternoon. So with the combination of those, I was able to actually stop drinking energy drinks and caffeine, all of it. I don't drink caffeine anymore, no more energy drinks. And my belly is like almost completely flat. So that's really big for me, because I just had twins a few years ago. So for the fact that I've had twins in the last couple of years and I no longer drink caffeine and my belly's flat, I'm really happy with those results. So that's part of the reason why I really love these products. But the PFT is another one that will definitely help with the weight. And that's another one that I started taking last month, and the weight just keeps coming off. So I'm really happy with that. So those are great products, and I've had really great experiences with them.
Amazing. She calls me up one day. She goes, I don't have a belly anymore. Her husband told her she doesn't have a belly anymore. I'm like, I don't understand. What are we talking about? You have no belly, like it went flat, or we have some sort of medical issue here and I need to call 911. I'm not sure where are we going with this. Too funny. So yeah, so that's just some of the possibilities. I do want to mention about this product because it's hugely important, especially as we age. So I feel like I'm completely aging backwards with these. So this is for the heart. I don't have a high blood pressure or low. It's pretty good, my blood pressure. A little bit on cholesterol, mostly on blood pressure, but for me, I take it for the circulation. I feel like as the older I get, the more help with circulation I could use. I also do a lot of sitting at the computer. So I also have a dog. I'm super blessed. So I have to walk, whether I like it or not, outside, which is really good. And yeah, so that's what I wanted. I wanted her to sort of cover that, because that's huge, 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 huge. I just want to go through a couple of these products. Did you want to share anything, Nikki, before I start?
Yes, I want to talk about the NRM.
Oh,
Is that okay?
absolutely.
This was the product that I reached for when my sugar was high that day. And if you know anything about diabetics, my doctor calls me a type 1.5 diabetic, because I am a diabetic as a result of prolonged use of steroids and of cortisone, which has caused other damage. And therefore, my sugar is uncontrolled. I'm insulin dependent. And I take insulin, check my sugar. And because I still take prednisone, my sugar automatically goes up anyway. So then I take fast acting insulin, and I just didn't feel like it this day. And I had this box of NRM, which somebody had recommended, and I'd taken it and thought, yeah, I'll be supportive. And yeah, Linda, don't worry, I'm talking about you. So I went ahead and got these things, and I thought, well, why not? They're here, I'll try it. My sugar was running at, I think it was 235. I took one of these, and in 10 minutes, it was down to 195. I thought, oh, well, that's great. Let's see what happens. I'm sure it'll go back up in a moment as soon as these delicious lozenges that you suck. So much better than sticking a needle in my arm, that's for sure. And you know what? It's cheaper too. And within half an hour, it had dropped down to like 155. And within an hour, my sugar was within range. It was, I think, 110 or 120. So, of course, Doubting Thomas here said, oh, well, yeah, must have just been a natural occurrence. But the next time it happened, I tried it again, and it worked again. 2 days later, my husband was ill, and his sugar went up to over 300. He had exactly the same results. Within an hour, his sugar came down to normal range. And he's not insulin dependent. So that was wonderful. We didn't have to rush him off to the doctor or to hospital. As a result, I take these rather than taking my short-acting insulin. Now, I'm not suggesting you do that. However, it worked. It still works, so much so that we actually took them to our doctor. And I haven't had a need to go back to the doctor yet, so I haven't spoken to her again, because they really did work, and they've continued to work. And that led me to go on to the next product and the next product. And you're seeing us show all these different boxes and kind of going, you guys are nuts. These are not like chalky vitamins. I was taking vitamins for almost every one of these things, and I was taking handfuls of them. I had to have 2 pill containers for my daily vitamins. Now I have a beautiful lozenge that I can put in my mouth. It tastes good. It's smooth, and my body absorbs it immediately. And people have seen the results in me, seen the new energy in me. And a couple of the ladies in my programs have started using them. But you know what? They keep giving them to other people because they've experienced them using them once, seen it work, and they're giving them out. But really, this NRM was the start of my candies journey. And I'm very new to all of this, and I absolutely believe in it. I've seen it in myself, and I've seen it in my husband and in the lives of the other people who are taking them. So that's my chat about NRM.
Awesome. Does anyone have a box of PFT close by that they could just show? Because I do want to go back to PFT for 1 sec. When I was part of the testing group, and I'm 5'7". I'm not a small girl, just so you know. And I lost, there it is. I lost 16 pounds, but more better, which is proper English, more better than that. I lost 3.5 inches in my waist and 4 inches in my hips. This product goes after visceral fat. It'll go right after that. All that fat that's wrapped itself around your organs, which is what's slowing them down, all that fat around that liver, so that now it's called a fatty liver and there's fat inside and so on and so forth. This is what it goes after. This is it. The belly, you want to remove a belly, do that. Couple that up with the 30-day metabolic reset to help cleanse and prep your body, and then put in the PFT, or start with the PFT and that, like I did both at the same time. Oh my gosh. Oh my gosh. So 16 pounds out. So altogether I'd lost 31, and then it was one party after another, so I binged off a little bit. I really didn't diet, but I was eating maybe a little bit less junky stuff than I would otherwise. I don't work out. I do my stretching and my yoga in the morning, and I walk. That's it. I don't work out in a gym. I probably should, but I don't. And you don't have to either. Walking is good if you can walk at least a half an hour a day, if nothing else, and walk slow. Start slow, and don't walk a half an hour if you can't, for whatever reason. If your knees or hips or, lower back won't support that, walk for 10 minutes, walk for 5 minutes, and just try to grow each day, and you'll see. It's amazing. But I want to get into some of the products, because I want you to see what the ingredients are. How are we with time? Oh yeah, we're good. So the whole product is made from the DNA of the plant. First of all, DNA of the plant speaks to your DNA. Okay, so even if it's made with bananas and you're allergic to bananas, you're not going to be allergic to this. Now, you might have a reaction that's a detox reaction, but it's not an allergic reaction. So if you're detoxing fast, that just means your body's super crazy toxic, and now there's, all this toxic stuff coming out. It's a tough one. I get that a lot with the MLS, because it will clean up your microbiome. So you want your microbiome cleaned? Yeah, be prepared to do some detoxing. I just want to give you some of the ingredients so that you see they're GMO free, halal, kosher, vegan. Help me out, ladies. There's no way I'm going to remember all of them. There's so many of them. Vegan, GMO free, gluten free. What else can you guys remember? Anyways, there's a lot. There's a whole list of everything, and I don't even have one of my pamphlets. They're all in the car because I was going with them. Anyways,
there's so many benefits to remember. There's so many.
There's pesticide free, animal testing free. Put it this way, everything that's in there is 100% natural. And this skincare line you see behind me is not yet available to us in Canada, but I'm hoping that at convention they're going to tell me when they're coming to Canada. They are, however, available to the US. All of US, you get these products. So I'm just going to tell you briefly. The owner's wife, so the founder of the whole company, she got pregnant, and she wanted to have a 100% toxic free product to put on her face. She couldn't find one. So what does a girl do when she can't find one? She makes one. This is the result. Not only is the product 100% chemical free of anything, the product they're very vibration aware. So the product is packaged in not plastic, that's for sure. Not just any glass, but Venetian glass. Yeah, Venetian glass. Like you're going to want to keep the containers after to reuse them somehow. And there's a beautiful mist. See that product right there? I think that might be it. There's a gorgeous mist that I use all the time. I'm like, I gotta do oils in here. So I did get my hands on a little bit of the product. The girls, when I won the trip to Dubai, they brought me some, and then I went to Maryland earlier this year. So I stocked up. I thought, okay, this will have to keep me until we actually get it here in Canada. So I'm so excited about that coming to Canada. I can't even tell you. And back to the products, because I promised you I will give you some ingredients. So that blood pressure one for the heart, grapeseed, hawthorn, white mistletoe, pomegranate, raspberry, wild strawberry. They are candies. We call them candies because they're sweet and they're sweetened with beetroot and with molasses. They're hermetically sealed and they will last you forever. You will die and these will still be around. Like that's how long they'll last you. And I accidentally left some in, actually one of my clients, his kid accidentally ate a whole thing. And he's okay. Everything was fine. I accidentally left some in the car in this kind of heat in July. I usually don't carry them in my car because, you know, nope, they actually work. So I guess I could carry them if I want.
I
still
have to disagree with you, Marianne. You say they will last forever. They won't, because you'll eat them
That's
first.
true. That's true. That's very true. Okay, so the liver detox, you ask what's inside, even though you didn't, I'm going to tell you. Artichoke, dandelion, milk thistle, turmeric, peach, avocado, and raisin. The MLS, where's the MLS? The one that will eat away at your candida and give you a flatter belly. Oh my gosh, we're going to be here all day. And plus they're a little bit cut off at the end. Thyme, ginger, cinnamon, turmeric, clove, licorice, chamomile, echinacea, artichoke, fenugreek, dandelion, coriander, cranberry, papaya, mandarin, grapefruit, blackcurrant. And I don't know why the last two are cut off, and I want to see if I can find the ingredients anywhere else. I don't think they have the ingredients here. Oh, well, that's too bad. I don't know where I'll have to get more organized for this. But that's just, there's two more ingredients that I can't see, but I'm sure one of them is ashwagandha because ashwagandha is almost in everything. So the grow, which we didn't show you, does anyone have a grow? Oh, I have a grow. This product in 2020 won an award out of 423 plot products. This came out as #1 as an immune booster in 2020. Well, that's all we talked about was the immune system. So that one has European olive, echinacea, astragalus, reishi mushroom, ashwagandha. Oh, my nutritionists are going, oh, yay. And the other people are going, what the heck are those things? Balsam pear, aloe vera, cranberry, bilberry, pomegranate, rowan berry, husk tomato, black currant. That's a lot of product. No wonder it was #1. All natural. Keep in mind, all natural. Sweet. No, if you have any issues swallowing, I have clients that can't swallow regular size capsules or anything like that. Like maybe like a baby aspirin, if you're lucky, they can swallow. And you know, when you're swallowing down some of those capsules that, and they come apart and yeah, anyways, I don't want to get gross. So easy to take, easy breezy. Now, even if you couldn't take them, and even if you don't like sucking on candy and you don't want it inside of your mouth and you want to swallow it, at least suck on it for a little bit so that it goes into the mucous membrane and then swallow it. Or you can put it into a cup or a glass of water and at room temperature and just leave it. It will dissolve and then you can drink it that way. That's how I give it to my dog. Sometimes I give it to him directly. So my dog suffers from anxiety, so I give him the Relax, and I also give him the one for parasites, because guess who has a lot of parasites? Our dogs, right? And guess who likes to kiss our dogs? Pretty much all of us, all dog owners. So parasite one, mandatory. Okay, GTS, the one that Amanda said she basically substituted her energy drinks with. And also it's supposed to be really great for sports people that work out a lot. It's really good for your muscles and it gives you better muscle tone. Okay, here we go. Green tea, Siberian ginseng, magnolia, vine, water, hyssop, ashwagandha, again, pineapple, gooseberry, apple. The NRM that our Nikki was talking about for bringing down your blood sugar, Malabar tamarind, Siberian ginseng, gumar, balsam pear, fenugreek, apple, and lychee. I don't think anything's going to hurt when you're taking these. Okay. Oh, this one's cut off too. I'm not going to be able to read all of it. The male, the testosterone one. Yeah, ginseng, ashwagandha, damiana, and ginger and lemon, and that's all I can see. There's one more thing in there that's cut off. The power for the estrogen one is damiana, asparagus, ginkgo, ashwagandha, ginger, and apricot. The relax for sleeping and for anxiety and depression. Chamomile, Siberian ginseng, passion flower, ashwagandha, banana, and lettuce. Simple. It's like you're eating food, only in a cute little candy. There's just enough. Take one a day or two a day, depending on, which way you need to go. And one of my products, which I also don't seem to have a box around here. Oh, maybe I do. Hang on. Oh, this is a savior. 60 plus people listen. Actually, you know what? 50 plus, you know what? Maybe even 40 plus people listen up. Can you say anti-inflammatory? Yeah. You know what I used to take for an anti-inflammatory? Advil. Yeah. Extra strength. Now I take maybe 2 or 3 of these, or 4 if I really have to, if it's really bad. Inflammation, what do you call it? What do they call it? Like in Taekwondo when you're the master of some, I don't know. Anyway, inflammation mastery, I want to say. Ingredients: ginger, grapple plant, licorice, green tea, turmeric, pear, and wild strawberry. Who knew that combo would have done it for you? And one last one, and I definitely don't have this one anywhere close by, is the STP. And that one is for pain. Oh, look at my girls. Look at this, is like Vanna White and Vanna White. Vanna White 1 and Vanna White. Okay. Oh gosh. Ashwagandha, turmeric, grapple plant, ginger, licorice, cherry, raspberry, cayenne. And something else that I can't see that got cut off. So that one will actually, if you have pain of any kind. So first of all, if you have pain, there's inflammation. So you need the inflammation in that one. And those are the 2 I've been using for the last month and a half. I have a little bit of a groin hip injury from when I fell. And every once in a while, it'll just show its ugly head and just invade my space. So that's what I've been using. Not that I want to say anything bad about Advil or anything else, but I don't need to use any of that. This is all natural. It's like taking food, only I don't have to sit there and think about which combination of food is going to work. And it's because it's made from the DNA of the plant, it works quickly, it absorbs very quickly, and it's all infused with negative ions. So if you don't know what negative ions are, you should probably read up a bit, because it's such a big thing. If you've heard of grounding, if you walk barefoot on grass, that's grounding. There's various grounding tools. I actually have a tool here that will help you with actual negative ions. It's a really cool device. It's also $3,500. And it's great and it works great, but it's $3,500. And I'm lucky that it works on me, but for my people that come to me, they only get it when they come to me, right? So this here that I read off is the metabolic reset. This is the price in US dollars, $324. I think in Canadian it's $4 and a bit. I can't recommend this enough as an overall cleanse, but not even just as a cleanse, but an overall healing tool. This will heal your insides. This will heal most of your, no, this will heal all your organs basically. And so we're not sure how toxic you are. So you might need 2 months in a row. You might need 3. There's been people that haven't really noticed much of a difference until they hit the 3rd month. And then it's like, oh my gosh, like the flood just started and all of a sudden they lost weight and all kinds of different things. So you're going to find that you're going to have more energy. So I've been using all these products now except for the ones that came out later. I've been using them now for about 1.5 years. I really feel great. Like the fact that I have, and if you're going to be a control freak over something, this would be a good thing to be a control freak over. I have some control over my inflammation. I feel like I was inflamed all the time. I don't know about you, Nikki. You're still kind of young, Amanda, but there's still some inflammation there. But when you're diabetic, and I'm not diabetic, and I don't plan on being it, I am insulin resistant though. And the minute you have that, there's inflammation in the body. I don't care what you say. I don't know what you've heard. There's inflammation there. And if something's not right, there's inflammation there. Inflammation is the culprit. And so when you take down that inflammation, like I had really horrifying allergies, and I used to take something that begins with a B and ends with a drill at the end. And I used to take it for 3 months at a time. Can you imagine taking anything for 3 months, like med of any kind, even though it's over the counter? And then same thing, that would be in spring, and then again maybe 2 months in the fall, because the fall for whatever reason didn't seem to be quite as bad. And I've completely replaced that with the ALT, which I also don't have close by, but I'm sure one of my Vanna White girls will. Yep, there it is. And that product was my first savior product for me. That's the one that did it for me. I had a really bad cold on the day that my order got delivered, and I wasn't even going for that. I was just going to see, check out this product because it's infused with negative ions and made from the DNA of the plant. And I'm like, what are you talking about? I have negative ions. That's like, what? How can I can't even say no to that. And then, yeah. And then I discovered that my allergies, I took that for 3 months instead of the other thing. And then I took that for 2 months. And then the following year, which is this year in spring, I used maybe, and I'm being really generous, I don't think I used even a full box for the whole season. That's how much I cleaned up. So also I used a lot of extra, not a lot, but like extra SLD, the one for inflammation, because my hip was acting up. And I think once you bring the inflammation, so whenever I have someone with allergies, I give them the ALT and the SLD to take those two, because once you take down the inflammation, then the rest of it can work better. And then if it's really, like for me, I could, and a lot of people are like that. They could easily have like an asthma attack. It's so bad. So then I do the, I know I had it here, the air, and that one actually works really nicely on the actual lungs. And I've noticed that it helps. I don't know if it's because all of our products are anti-inflammatory and they all have the negative ion component. So I find that they help to take down the inflammation and also the fever. I think that comes down automatically with the inflammation. So that's what I've noticed for, most of the people that have tried. We have 18 products altogether. If you want to know more, come to me, Amanda, or Nikki, and we will be more than happy to help you. We all pretty well understand the product. Because I've been here longer, if there's questions, I'm happy to join into the conversation and we can have a 3-way call. And that'll be fun too, in another way. And so with that, 102, Jose's not here, so he must be coming soon. He's going to be speaking at, just as soon as I said it, there he is. Jose's used it as well. So anyways, I do want to thank everyone for listening, and thank you ladies for sharing. Any final words from you two lovely young ladies?
If you're doubtful, give it a try. They're cheaper than your vitamins in most cases. So just try it. And hi, Jose.
And they're supernatural. They're super natural. Amanda, any last words?
No, I just want to say thanks for having me on. And yeah, you definitely should try them. Honestly, it's made my life so much more easy just because they're easy to take with you. So again, thank you for having me. And yeah.
Definitely try them. You have nothing to lose other than your issues. And as you're losing your issues, you got to get some tissues. Okay, now I'm just being ridiculous.